Kathy's here from Fraser Health, and she's going to be speaking about transitions to home health care. We've heard over the last few months from many of folks in our community, specifically the Burnaby PCN Seniors Working Group, that sometimes there's anxiousness when identifying when you need home health supports. How do you get home health supports? And just what are the steps and what does it look like to access home health supports? So Kathy is here today to just talk us through some of those processes and steps. And we will also put on our website some more information about home health supports. Thanks everyone, and thanks Kathy.
You're welcome. Thank you for having me. So my name is Kathy Battocchio. I'm a team leader for the community health nurses at Burnaby Home Health. I've been a nurse for say 30 years, and the last 16 years have been in home health. And I've also much of my career was in the hospital, so I know both sides. I'll just read briefly from our pamphlet regarding what the purpose of our community health nursing services are. We're a provincially funded service to the community. That's part of the Fraser Health Authority Home Health Services. The community health nurses are registered nurses or licensed practical nurses. And our goals are to provide support that enables our clients to remain safely at home for as long as possible, to prevent or delay admissions to hospital or to residential care, and to facilitate discharge home from hospital. Our services have an eligibility criteria. This is from Ministry of Health. The clients that are referred to us must have Canadian citizenship or permanent resident status. They must have 3 months consecutive residency in British Columbia immediately prior to the application for services. And the individuals must be 19 years of age or older. So when someone is referred to us, anybody can refer. Usually our clients are people that are still in their homes and they need some supports with personal care. Maybe it's becoming more difficult for them to get around. They might have mobility issues. They might have some dementia starting. They may have limited supports, limited family, and they just need some assistance once a day up to 3-4 times a day to support them to remain at home safely. There's a cost for that service. So the community health nurse that would come out to assess what your needs are would also do a financial assessment. And so if the client needs home support, which is assistance for personal care, there would be a daily fee based on their income. If the client moved to assisted living, funded assisted living, there's a monthly fee also based on their income. Residential care, which is now called a long-term care home, there's a monthly fee in effect, and it's based on income as well. There's also adult day program, which provides respite to caregivers, and there's a minor daily fee, which is between $6 and $10. And there's respite care, which I'll explain in a little bit more detail. There's a daily fee for that, which is about $40 a day. So what happens is if someone is referred to our services, we'll get a referral and it'll come to the community health nurse, and they'll give the person a call and determine what's the reason for the referral. So it could be that a neighbor has concerns or a family member has concerns about how a senior is managing in the community. Maybe they've had some falls, maybe they have some mobility concerns, and perhaps they're having difficulty accessing things like getting their groceries. So the community health nurse will first have a phone call, and then she'll arrange to make an appointment and go to visit the person at home, and she can, or he, we have male case managers as well. They will assess the sort of home situation. Is there lots of stairs? How is the person managing? Do they have family to help them? what's their mobility like, do they possibly need some equipment. And so that community health nurse will do an assessment that is used across Canada called RI assessment. And that assessment will provide scores and a care plan, an approximate care plan as to what the needs of that client might be in the community. So based on that, we can put in some home support service. We have a discussion with the client and the family as well as to what type of services they would be wanting or willing to accept, or that they feel might be helpful. We are limited by the Ministry of Health guidelines in that we don't provide housekeeping, vacuuming. We don't do physical grocery shopping. We can't take someone to appointments, so we don't do those things. If we arrange home support for someone, it's carried a community health worker that would come into the home and provide personal care assistance. So that could be assisting the person to get washed in the morning, to transfer from their bed to a wheelchair, or to assist them to mobilize to the bathroom, to help them with their toileting, help them to get dressed, in some cases help with medications. We don't prepare food, but we can heat food that's already prepared by family or by meal delivery service. And we can set that person up. Some persons may need queuing or supervision to ensure that they eat. Some people forget to eat, so the care worker can stay and assist with that. And they stay just long enough that the tasks that are indicated in the care plan are completed, and then they move on to their next client. So if the community health nurse books an hour in the morning, for example, for the morning service for a client, it's not rigid in that community health worker will not stay with that client for exactly 1 hour. They have travel time at the beginning and the end of each visit going between clients' homes. And like I mentioned, they stay long enough to complete all the tasks that have been put in the care plan for them. So that's home support for personal care assistance. So sometimes there's folks that are living at home and their spouse or or another relative, a son or a daughter or a niece or nephew, sometimes even a neighbor, are providing actually their most of their personal care assistance. So that's their primary caregiver. And sometimes that caregiver needs some relief. They may have their own appointments or they may need a break. So in those cases, we can put in some respite care. There's some staffing challenges at the moment, so it's a bit tricky to get blocks of respite care during the day at the moment, but it's assessed as per each individual needs right now. So if someone is really needing that, we'll try and make that work. So what that is a care worker will come to the home for a defined block of time, 2, 3, 4 hours, and stay with the person who is at risk to be left alone so that their primary caregiver can go out and do their appointments or have their break. The cost for that is the same as the cost would be for the home support. Incidentally, to be clear on that cost, it's, as I mentioned previously, there's a financial assessment that's done, and based on the income, there may be a fee. For clients that are on the guaranteed income supplement from the government, there is no fee. So the cost for home support is zero. There's also overnight respite. So that would take place in a care home. So if, to use my previous example, if there's someone living at home and their primary caregiver is their family, and maybe they also have some support in place from us, but the family need to go away for, say, a week or 4 days. If they know that, they know those dates in advance, they can contact their community health nurse, and we can look at our list of respite providers, which are long-term care homes in Fraser Health that have beds set aside specifically for overnight respite care. And so we can make a request and we have to send in an application. And then that person, the client, can go to that care home for the 1 week or the 2 weeks or the 4 days. And they receive 24-hour care during the time that their family member is away. So the family member then can be away with no worries. The overnight respite is limited to 30 days in a year, plus an additional 15 days that could be booked separately. Some families that have been with us for a few years, they utilize that for their vacations. And so they know each year they're going to have 3 vacations and they pre-book their times. And then other people use it more as unexpected things come up. It's more challenging to book overnight respite on short notice and for unexpected reasons, but we are often still able to get some days even on short notice. Let's see what else here. We also, the community health nurses, they were previously known as case managers, so you'll hear me use that term as well. We are connected with home health liaison team in Burnaby Hospital. So the team leaders here in Burnaby Home Health, we share responsibility for that team, and the nurses there perform the same role as our community health nurses here in home health, in that they set up services for people that are going home from hospitals. So if someone has been in the hospital, say they had a fractured hip or broken arm perhaps, or they had pneumonia, and they need some support when they go home, the home health liaisons will put that in place, set it up, and then they will refer to us, and a community health nurse will then go and see the client once they're at home. It's not within the first couple of days. They will phone the client and they will book it within a time period, but the services will continue until the client is seen by the community health nurse. We also have services in home health that mirror the services that are available in the hospital. So in the hospital, where you might have access to physiotherapy or occupational therapy or social work, we have those services in the community as well. Physiotherapy is more for mobility needs, and occupational therapy is more for fine motor type needs, such as dressing and eating and toileting, and equipment needs. So depending on the needs of the client, that will determine the referral. If someone in the hospital is coming home and they need some equipment, like maybe a hospital bed or a commode, or they might need a lift, the occupational therapist in the hospital connects with our occupational therapist in the community and arrange for that equipment to be put in place so that when the person comes home, it's there, and the health workers that will be providing some assistance to the client, or if the family is the one that's providing the assistance, then they will get trained or shown how the equipment works so that they can provide safe assistance. What else can I tell you? We also have home care nursing. The community health nurses that arrange with personal care services, they will do some home care nursing services as well. So for people that have a catheter, they will do those monthly catheter changes and urgent issues with the catheter, and non-complex wounds. So people that have wounds that might need once a week attention, the case managers, community health nurses will deal with those for their clients. If the wounds are more complex and require more frequent attention, then we have a home care nursing team here at Burnaby, and the home care nurses will follow that wound. And then when it gets to the point where it's improved and it can be seen once a week, it would come back to the community health nurse. Let's see what else I can tell you. So in the hospital, the cost of being in an acute care hospital bed is very expensive. It's approximately $1,500 a day to stay in an acute care bed in hospital. So when somebody is no longer acute and is ready for discharge, there's always other folks needing those acute beds. And so we try and arrange that transition home as soon as possible with the necessary services in place. So that's where it's imperative that our home health liaisons at the hospital and the community health nurses here connect. And they do connect every day. So every morning we look to see if any of our clients are in hospital, and we reach out to the hospital team to find out what the estimated discharge dates are so that we can be prepared to support the clients at home. Some persons that are living in their home in the community, they are still relatively independent, but they want that little bit of more support. Maybe they don't want to live in a big house anymore. Maybe they want more people around them. There's many folks that live alone with some social isolation. So they might think that assisted living or independent living would be good for them. So for independent living and assisted living, there's private options available, and that's like a rental agreement. If you can find a location that that has private assisted living beds or independent living beds, and you are in agreement to the services that they provide and the fee that they charge per month, which is like rent, then you can make that arrangement on your own and move in there. If you would like a funded assisted living, then there's an eligibility criteria for that. So folks in assisted living have to have a couple of care needs anyway. So they need some degree of personal care assistance and maybe medication assistance, something like that. And they also, they need to be independent, relatively independent with their toileting. They need to be safe to be left alone in the suite. They need to know what to do in an emergency to get out. And they need to be safe to be alone in their suite overnight. They can come and go as they wish from assisted living. So it wouldn't be appropriate for somebody who's has some memory impairment and may get lost if they went out of the suite. So assisted living is sort of like your own apartment. You have meals in a dining room with other people. You have laundry assistance for sheets and things once a week. And you have some minor housekeeping assistance once a week. So that's funded assisted living. The fee will be based on your income. There's no funded independent living, that's only private. After assisted living, the next level is long-term care home, and that's 24-hour care. And that's for persons that have significant care needs. They may need care with all aspects of their day. So washing, dressing, getting to their meal, toileting, transfers, queuing. They may have memory deficits, respiratory challenges. So people that go to long-term care have a high level of care need. So again, there's an eligibility criteria. The assessment tool that I mentioned that's used by the community health nurses, the RI assessment, when they come to visit clients in their home to determine needs. That's the tool that's also used to determine eligibility for assisted living and for long-term care. And it creates scores, and those scores indicate if a client has high enough care needs to get into long-term care or assisted living. Wherever possible, we want to delay that transition. So we will try and support the client at home for as long as possible before moving. And most clients want that. They do want to remain in their home as long as they can. In some situations, that's not possible. Maybe there's many stairs in the home. Some persons that have memory deficits aren't able to know how to use the buzzer system to buzz workers into their apartment anymore, and then that becomes a challenge, and those become factors where we end up having to transition someone to another location, living location. There are times when someone goes into the hospital and they're unable to return home and need to go to long-term care from hospital. Wherever possible, that is, the person is, we do attempt to have the person come home first and go to long-term care from home. Sometimes it's not possible. If the person is going to long-term care from hospital, they have less of a choice in which bed they, which facility they will be admitted to from hospital. So, and that is to prevent congestion in the hospital where occupying an acute care bed by somebody who's no longer acutely ill. So, whereas a client waiting in the community for long-term care, they can make 3 choices for preferred care homes, and they can choose to stay in their home waiting until one of those beds comes available. And that could be 6 months, it could be a year, but that's their choice if they wish to wait that long for their preferred care home. If they don't want to wait that long, and they feel that it's more urgent, or the family feels that it's more urgent for the client to be placed sooner, then they could choose to go to an interim care home. And so those may not be in the exact care home that you want, but you will get moved more quickly, providing relief to your family or relief of anxiety for yourself. In the hospital, there's no opportunity to wait for a preferred care home while you're in hospital, because that's too lengthy of a wait to occupy that acute care bed. So from the hospital, the transition will always be to an interim care home. The client or the family is able to choose the geographic area that they would like to live in. So Fraser Health has geographic areas rather than single communities. So for example, the geographic area that's associated with Burnaby is Burnaby, New West, Coquitlam. And so a client waiting in hospital for a long-term care bed could go to an interim care home in any one of those 3 communities if the client and family have chosen the Burnaby geographic area. There's more information about that in one of the pamphlets, and I'll send the links to Andrea so that the geographic areas are listed in the back of the pamphlets, 2 of the pamphlets. So assisted living from the hospital, again, if someone is appropriate to move to assisted living, that means they're safe to be alone in a suite overnight in particular. And so it is not likely that if a person has to wait in hospital to go to assisted living, that they would be eligible for assisted living. There are exceptions to that, but usually people that are eligible for assisted living are able to go home to wait. And that is the expectation, that we support them in their home while they wait there for an assisted living location. Sometimes, do you have a question, Andrea? Okay. Sometimes there are clients in hospital that aren't quite ready to come home or go to another level of care. And they may need some rehabilitation or some convalescence. And so they may be transferred from hospital to one of those locations first. And then from there, they might end up going home or to another living location. If they're going to convalescent unit, then the goal is usually to go home from there. What time is it? I still have
like about 2 more minutes.
Oh, okay. Did you
oh no, maybe about 10 more minutes.
Okay.
10 more minutes.
Is there something in particular that you want me to address that I haven't?
I'm just curious, maybe you could maybe the process from even just like the phone call. I'm sorry if I didn't hear from the initial kind of phone call, how long are folks expected that before they get an assessment?
Yeah, so that we have a priority process. And so what happens is, say somebody is coming home from the hospital, and I'll use that example, and they're coming home with 4 times a day visits, and they have a hospital bed and a lift. And the home support hours that are put in from the hospital are going to run out then within a few days. So then we will try and have the case manager or community health nurse see that client within that time frame. If there's someone coming home that just has some minor mobility challenges and they just need some assistance with their morning care to get up and going in the day, the community health nurse can contact them and extend their service and then arrange to see them in 3 weeks, maybe even 4 weeks. It depends on the clinical judgment of the community health nurse, the needs of the client, the availability of the client, and also availability of the community health nurse.
Yeah, and then I guess, just knowing a lot of the folks that you probably work with and that we also support with our community partnerships. Is there translation services available when people make that phone call? And then is it possible to either have first language speakers as home health support, or can like the provincial translation services be included?
So we do have translation services available. So if we're aware or make that first phone call and find out that we need some translation assistance, then we can set that up and arrange that for another phone call for sure. We can also have that at the visit when we visit the client at home. We can have translation services. As far as community health workers, there are definitely challenges with having community health workers that are specific with specific requests, such as only males or only females, or specific language requests, because the community health workers are a union group, and so the work is assigned by seniority, and so it's more challenging to do that on that basis.
Yeah. And then is there scenarios where, I'm just thinking about maybe older adults in couples where both couples might have home health support? Like, do those scenarios exist?
Oh yes, we have many couples, yes, where they both receive service.
Okay.
And incidentally, regarding the fee, if they're both receiving service, it's one fee for that day.
Okay, great. That's really great. Is there any questions from anyone that's listening right now? There's a lot of you there. Feel free to type them in the chat.
Who makes, so someone writes, hang on, I'll start at the top. Sorry, I can't use a headphone, somebody asked me.
Oh, that's okay.
Okay, so who makes the referral for home health and how is that done? We get referrals from everywhere. We have referrals from the neighbor. We've got referrals from the police, from people's nieces, nephews, daughters in Ontario, you name it, anybody can refer. The number that they refer through is a home health service line. And I have that number on a pamphlet that I'll include, I'll send to you, Andrea, so that you can share that. Okay, who makes a referral for home care? How is it done? So when the referrals come into our clerical team, they usually will, the home health service line will have already assigned some sort of priority to it based on the information that they collected from the referrer. And then that comes into our clerical team in our office, and our office is across from City Hall on Canada Way, if anybody wants to know that. And the clerical team then gives the referral to whoever the referring referee is, whoever the professional is that's supposed to receive it. So it could be the occupational therapy, physiotherapy, could be our community health nurse. And then we review the referral and see if we agree with the priority that's assigned, and we contact the client and go from there.
I
How do
just put
people
the
get-
phone number. I think that's the phone number. I got it from the web.
Sorry, I can't see it.
I put it in the chat.
Okay,
Yeah,
I'll get down there.
yeah.
One says, how do people get help with cooking and shopping? There's a lady who's nearly blind in our building who does very well, except using a stove. So there is grocery delivery now. So if there's somebody that can help her to make a list, sometimes our community health workers that can be part of the care plan, that they help her with a list, and then they can phone for the delivery for her. And then if she's not able to cook, we can't cook, unfortunately.
Burnaby Neighborhood House also has some supports that are around meal preparation. I can put some info in the chat as well.
And there's meal delivery services, Meals on Wheels and stuff like that. So if that's in the house and frozen meals and soup, then, you know, we can actually heat that up. So we can do that part, and that can go in the care plan. Is there a need to get a referral from the doctor? No, it does not have to be from the doctor. And the number that you put up there for the service line is correct, yes. So I just want to comment on the fees, because that causes some confusion with our clients. So we have what's called a per diem fee based on your income. So that means per day. So if the client has 3 visits a day, it's still one charge. So it's a daily charge, not a per visit charge. All right, for the home support, for personal care assistance. So just to provide some clarity on that.
I've just added the grocery meal delivery program that's supported from Burnaby Neighborhood House. It's a United Way funded project that they do have prepared meals.
Great.
Yeah. So we're getting close to end of time. If there's any final questions, just put them in the chat. Otherwise, thank you so much for your time, Kathy. It's really great. We've been wanting to hear from someone in home health for a while, and it's really nice that you're here speaking with our community.
Well, you're welcome. Thank you very much for having me. And anybody is welcome to call us with questions. You don't have to have a referral. So if you have a question, you can go through our front desk, and you can ask to speak with me if you like. And our front desk phone number is 604-918-7447. Okay.
Thanks so much, Kathy.
Okay. Everyone have a nice day. Thank you.